Well, with the better weather we've been having lately, we're more likely to be playing outdoors and working in the yard. And as we clean up and play hard, we put ourselves at great risk to physical injury and trauma. Look at what happened to Bobby Jackson. Remember this last week with the Kings where he was whacked. He suffered an orbital floor fracture of the eye socket from being hit in the cheek by Rafe LaFrentz. More severe injuries can result in actual loss of your eyesight. Here to discuss this and what we can do to protect ourselves from some more common injuries is Dr. Brent Reed from Griffin and Reed Eyecare. Speaking of the Kings, doctor, we were just chatting about that. What exactly happened with Bobby in that case?
Well, anytime you're hitting the eye wall and you're hit to the point, your eye kind of sits at the top of a ice cream cone-like bony structure with 4 different walls. The bone that's at the bottom of the eye socket that sits above the sinus is the thinnest bone in your body. It's called the lamina propria, and it fractures very easily. And what happened to Bobby is when he got hit, his eye was pushed back, the floor fractured, but apparently, according to the news reports, it was non-displaced. So there wasn't actually falling of the contents of the eye down into the maxillary sinus, which would have been very bad.
You see the hit right there. You wonder how he could come back and play in the next game.
Well,
that's amazing.
I'm amazed that he did come back and play in the next game, number one. And number two, I'm amazed that he doesn't have some kind of face guard or protector to keep that eye from being hit again, or to keep that arch from being hit again.
A lot of times the players would wear a mask or something. You've seen the Kings
I thought we'd see a hockey mask
Absolutely,
on it.
That does happen. For folks who play softball, for those who are playing racquetball, handball, you see goggles a lot. I mean, obviously, they have to do something for protection.
Yeah, 90% of the injuries you see from those kind of racket sport injuries or paintball injuries would be completely prevented if people would wear the proper eye protection. Unfortunately, when they don't, a good percentage of them lose significant amount of their eyesight.
What injuries would you say are the most dangerous that people might be participating in right now?
Well, probably paintball. There's also the risk of having foreign bodies in your eyes because everybody's out doing yard work right now.
Right.
And weed eaters are terrible. Weed eaters, the string breaks off, comes up, hits the eye, and actually causes significant damage to the eye as well. So you've got to be very careful about wearing safety glasses. Even just something as simple as pounding in a nail. If that nail flips off the hammer, it'll hit you in the eye.
Anybody who's working in their garage, certainly. We're talking about that, too, for added protection. Who else is at risk for increased eye injuries this time of the year?
Well, basically, the weekend athlete, the weekend warrior is the most common, and the person cleaning up the yard. Okay,
and also, as far as eye goggles and whatnot, I mean, what other things can people do?
Well, people often think that contact lenses are going to protect their eyes if they're prone to an injury. If anything, contact lenses may make it worse. Some chemical burns are averted by contact lens wear, but usually contact lenses provide no protection whatsoever. People that wear glasses need to make sure that their lenses are polycarb lenses so that they're tough enough to withstand the blow.
I think we're going to have a graphic that we want to put up that we're going to call for, and maybe you can comment about that.
This actually is a representation of something that happened, or similar to what happened to Bobby, except it shows the effect of a tennis ball, where the tennis ball hits the eye and it retropulses it back. And you can see at the bottom of the graphic there's actually a picture of the orbital fat prolapsing. This is a picture of a small metallic foreign body at the edge of a cornea. That we're looking at. Somebody wasn't wearing their safety glasses. This is the common effect of what happens to the iris after someone's been hit.
We'll see you next time. Stay with us. Back with the final check of the weather in Wall Street after this.